EMDR is eye movement desensitization and reprocessing. EMDR is from the AIP model, which argues that a trauma memory gets stuck. So not like a regular memory where if I asked you about your 5th birthday, then you may be able to think back to your 5th birthday, but your 5th birthday isn't popping into your mind on a regular basis. A trauma memory does pop into your mind probably on a regular basis and then bothers you and is like, ugh, this is uncomfortable. So EMDR argues that that memory is stuck. And so we're able to use bilateral, maybe fingers going back and forth, butterfly hugs, tapping, all sorts of different side-to-side movement to help the brain do what it naturally does, which is heal. So the brain wants to heal, your body wants to heal, but this trauma memory is stuck and it's causing problems in everyday life. And so EMDR can be really helpful in helping the brain and body process that memory so it's not popping up. Now, that doesn't mean that the memory goes away. You still have the memory, but the intensity of the emotions is reduced. There's some myths about EMDR. So sometimes people think, especially with the eye movement, they're like, oh, are you doing hypnosis? No, this is not hypnosis. You are always in control. And this is really important for any person who's experienced any type of distress, and especially a trauma survivor, that you get to be in control. You get to have choices. I'm not going to come in and say, this is what you have to do. You're always in control of your body, of your thoughts throughout this whole therapy process, especially with EMDR. So it's not hypnosis. It is not something that sometimes people think, oh, you can erase this memory. I wish. We can't erase hard memories. I don't have a magic wand. It's not magical. It is therapy, and sometimes therapy is hard. One thing that's cool about EMDR for some clients is that whenever I ask you to go back into that memory or to look back at the worst part of that image, you don't have to talk a lot about it. So with other therapies, you do need to talking about what happened or maybe writing about what happened and really identifying some thoughts and feelings. And I will ask, what came up for you? Were there thoughts? Were there body sensations that you noticed? Whatever comes up for the client is correct, is what the brain needs to do to heal. But you don't have to necessarily say a lot if you don't want to.